First of all, can I just start off by asking you this idea of the kind of pandemic, which has clearly had an impact even on the Prime Minister today on so-called Freedom Day. I mean, lots of people this morning saying this needs to change. Frankly, if you're double vaccinated, you're someone who's expanded the virtues of the vaccine. If you're double vaccinated, you shouldn't have to self-isolate at home. It's starting to have real impacts on businesses, on supermarkets. Why won't the government change on this now?
So it's just worth sort of setting out a little bit of background and then coming forward. So the NHS app has probably saved tens of thousands of lives and obviously alerted hundreds of thousands of people to self-isolate, rightly so. It was developed at a time before we had the vaccination program. We now have almost 88% of all adults with one dose, 68% with two doses protection. Today, we announced that NHS frontline staff and social care staff, if they are double vaccinated, which they are because they were in phase one, right at the priority, top of my priority to get them protected, then if they take a PCR test and they're negative, they can get back to work. And of course, on the 16th of August, all people who are over the age of 18 who are double vaccinated, if they are then alerted to someone they've come into contact with who has had COVID, again, if they test negative, they don't need to self-isolate, they can go back to work. We're being cautious deliberately because actually, having that clinical advice that you've been in contact with someone that has got COVID is the right thing to do. But also, lots of people, since the 17th of May, step 3, when we introduced the app and people being able to see their vaccination status and their medical status, something like 6 million people have downloaded the app. They haven't just looked at their vaccination status, they've ordered their medication. So prescriptions, 1.2 million prescriptions. They've booked GP appointments, over 100,000 GP appointments. So I think it's worth getting this in perspective, Darren. It's important that people have that clinical advice that they've been in contact with someone whilst we manage this totally abnormal year and try and get it back to as close to normality as possible as quickly.
But you understand that, for lots of people, this isn't Freedom Day today, as in there are literally millions of people having to spend time at home. And I come back to this point, like supermarkets are having to say that we may have to curtail opening hours because they don't have enough staff. I mean, this is having real world impacts now.
And you're right, it has been a incredibly challenging year for all of us. People having to self-isolate. I've seen it in my own constituency when I visited a brilliant Orange Mabel's cafe who's actually lost 2 members of staff to mental ill health and sadly suicide because of the severe lockdowns. But ultimately, what we want to try and do is get this virus to transition from pandemic to endemic status. We're doing that through the vaccination program. Almost 88% now protected with that one dose, 68% protected with 2 doses. But we have to do it carefully because, as we've seen from step 3, infection rates begin to rise, but the link between that and hospitalization is severely weakened. When I took this job on, you remember, Darren, we said that phase 1, the 1 to 9 categories, the most vulnerable, which we focused on, the over 50s, that is 99% of mortality. That's why we had to get them double vaccinated as quickly as possible. And it's great that they have come forward over 90% in all those categories in the 1 to 9. But there are no easy decisions here, Darren, but we have to work together, as we've done with the vaccines, the biggest mobilization in peacetime history. We have to come together now in step 4 and cautiously get our lives back, as we're doing, but remaining vigilant. This is a highly transmissible disease, aerosol transmitted respiratory disease, probably the most infectious in the history of man.
And we know, obviously, that one of the places that it does transmit is with children. And there's talk in the papers today that all children could be jabbed by the end of the year. Is that something that the government is looking at?
So we've now received the Joint Committee on Vaccination and Immunisations advice, and I'll be making a statement later to Parliament. Suffice to say, they've been very focused on vulnerable children to severe infection, children who live with vulnerable adults who are vulnerable to severe infection, and of course, those who are nearing their 18th birthday, 17-year-olds who are getting close to their 18th birthday, and continuing to review all other healthy children from data from the US and elsewhere who've had the first dose. They want to see more data on the second dose as well, because there is a signal, a very rare signal of something called myocarditis in young people. So I will be making a statement to Parliament later, but suffice to say, we have up to now done well by following the JCVI guidelines, and has served us incredibly well in our vaccination programme in protecting the most vulnerable, which has been the right strategy.
Very, very finally, I mean, there's a lot of people watching this morning, probably watching those images of nightclubs, feeling quite uncomfortable. The government's changed its advice in terms of, the expectation of wearing masks. I mean, for you personally, are you going to still maintain social distancing? Are you still going to wear masks inside? I mean, what are you doing?
Yeah, no, absolutely. Let me talk about sort of personally and the guidelines that I think are very clear to say to both people to take personal responsibility and for corporate responsibility, whether you are a host of a nightclub with large numbers of people or a supermarket or Transport for London. We make it very clear that this is a highly infectious respiratory disease that is aerosol transmitted, and it is recommended and, of course, supported that people wear masks in crowded indoor spaces. And it's good to see transport systems, supermarkets coming out and taking that corporate responsibilities. And then on the personal level, I will certainly wear a mask in indoor crowded places, because I don't know if the person sitting next to me may be immunocompromised or immunosuppressed, and it's right to protect them. This is a highly, highly infectious respiratory disease, much more infectious than influenza, which is why we're planning a booster campaign early in September for COVID, and of course a large-scale flu vaccination program, because there's not been much flu circulating in communities either because of the lockdown. And in a bad season, flu can sadly kill about over 20,000 people. So we're making big plans to both boost the antibody protection and T-cell protection of the most vulnerable in September, and protect them against flu.
OK, Nadhim Zahawi, the Vaccine Minister, appreciate your time this morning. Thank you very much indeed.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.